Hello, my name is Matt Cohen, and my CTR pilot grant is called Stakeholder Determination of Patient-Reported Outcomes from Speech-Language Therapy. And I'm very grateful to the CTR for the opportunity to do this work. Some outcomes from speech-language therapy are difficult to fully quantify with performance-based or clinician-rated measures and are better captured with patient-reported outcomes measures, or PROMs. An example from a cognitive disorder is, whereas cognitive errors or cognitive slowness are observable, cognitive effort or difficulty or confidence is unobservable to the clinician, but is often clinically useful to measure and is best done so with a patient-reported outcomes measure. Unfortunately, these and many other PROMs do not exist to measure many outcomes from speech-language therapy, at least not with the needed level of content specificity. So the two aims of this CTR grant are, one, to develop construct definitions for constructs that will be measured by future patient-reported outcomes measures that we'll develop, and two, to determine exact clinical needs of clinicians as well as barriers to dissemination and implementation in clinical practice. Aim 1 was accomplished by conducting semi-structured interviews with representative stakeholders of speech-language therapy services. The groups are shown there. These semi-structured interviews asked guiding questions such as, in what ways has your communication condition affected your mood, emotions, or feelings, with semi-structured follow-up questions. These interviews generated recordings, which were transcribed and then analyzed using Braun and Clark's 6-step approach. Looking at the results for AIM 1, these are still being analyzed, but so far we're showing that broad themes are being conveyed across stakeholder groups, suggesting that future PROMs would have good content validity across these groups, meaning you don't need separate PROMs for people with language disorders versus cognitive disorders because the construct is similar enough. So these themes have sub-themes, and then quotes that fall under those sub-themes will be developed into future PROM items. The second aim is to determine exact clinical needs and barriers to PROM use. To do this, we are conducting a national survey of speech-language pathologists, asking about their current use of PROMs, their need for future PROMs, and their barriers to implementing PROMs in their clinical services. The survey is still active, but so far we're finding that about 60% of respondents do not use PROMs for any clinical purpose, despite them being strongly recommended by the American Speech-Language Hearing Association. When they are used, it's mostly for goal setting rather than their intended use of assessing outcomes. And SLPs really don't feel adequately trained to interpret PROMs or incorporate them into routine clinical practice, suggesting this work is needed. These results will inform a resubmission of an R01 to the NIDCD, and we're very thankful to the CTR for the opportunity to conduct this work. Thank you very much for listening to this talk.